Welcome to the 13th Think Tank for the Health Economics and Policy Unit, HEPU, where collaborative thinking comes to life. Held at the Sigelege Boutique Hotel in Lilongwe, the capital city of Malawi, this conference stands on the successes of the past think tanks. Building off the 12th think tank, the purpose of this think tank was to discuss the research findings of the Direct Facility Funding, DFF, and their impact on shaping the future of healthcare resource allocation. The HEPU Director, Professor Joseph Bengo, warmly welcomed all attendees and provided a brief overview of the think tank's evolution leading up to the 13th session. Associate Professor John Cooker, the Dean of the School of Global and Public Health at the Community University of Health Sciences, followed the remarks praising the progress of think tanks and highlighted their impact on addressing challenges in the health sector.
So the traditional think tank is that a group of people think for others. But this one, we realize that it is moving away from paternalistic to thinking together, because we understand that the researchers may not have the questions. The questions are with the policymakers. And you may, if you do research without engaging the policymakers, you may have not appropriate question. And therefore, then we create also a policy lab. Policy lab feeds to the think tank is where the directors meet and the partners and decision makers, and then the policy lab is when the thinking has taken place, is where the science, the technical work begins.
We need clearly to have this high-level conversation so that we are in control, and then we are also looking at issues of integrity. I think whatever resources are being considered, integrity is extremely important, and for us, we champion this because Professor Mfuso Bengo here is a professor of ethics, right? And if there's a big challenge in this country that we are struggling with, it's the monster of corruption, which is really the mindset. So this is the start again of securing sustainability as well as our own integrity, and making sure that that happens all the way down.
The 13th think tank was officially opened by Dr. Jared Manhab, Director of the Department of Planning and Policy Development within the Ministry of Health, setting the stage for a day of insightful presentations and discussions.
On behalf of the Secretary for Health, I just want to express our appreciation and delight in the way the think tank is growing. I think when it started, it was a small institution, but now it's really heartening to see that it's grown to this extent. So it's really it's really very encouraging, and this has been achieved because of the commitment on both sides, government and the research side. I think there's been consistency from some of the members on the government side that are here, as well as colleagues from CUHES, and of course there have been a few additions from the CUHES side. So it's really we have done this because of commitment on both sides, and we appreciate that.
After a brief intermission, two presenters shared their insights on DFF international evidence. Dr. Tom Hart, a senior research fellow at ODI, delivered a presentation entitled Public Financial Management Arrangements for DFF, Lessons Learned from the Region. Dr. Convened, a senior health economist at Lilongwe, followed with a presentation on enhancing efficiency and effectiveness of direct primary health facility financing in sub-Saharan Africa. Next, Dr. Dominic Nkoma, Deputy Director of HEPU, presented on the highly anticipated Malawi DFF design, emphasizing on the goal, which is to increase access to equity, quality, and efficiency in the provision of healthcare services through enhanced community ownership and oversight, direct facility funding, as well as relevant public financial management capacity building in order to improve health at community, district, and national levels.
design for the DFF, the Malawi design, is built around at least some consistent attempts to check the contextual limitations that would have undermined a performance-based type of arrangement. Because as an economist, performance is something we should be celebrating. But I think it looks like in the African setting, trying to incentivize performance has been either catastrophic or costly.
He was later joined by Dr. Joel Zwanda, Health Economics Research Fellow at HEPU, who provided evaluation results answering the questions: is the DFF working? And is the DFF empirically and practically feasible?
We also looked at project effectiveness. As I indicated on here, we looked at to what extent was the DFF program objectives achieved. So we found evidence that most of the objectives were achieved with regards to enhancing facility infrastructure, as well as in terms of improving service delivery from the perspective of the respondents.
A lively question and answer session followed, allowing stakeholders to engage with presenters and explore the implications of findings. Dr. Nkoma facilitated a discussion on mitigating financial risks associated with DFF, and Ms. Michaela Wolfinger, a senior health policy analyst from HEPU, presented on DFF feasibility assessment, marking the end of engaging discussions. Dr. Mantalu closed the meeting with his final remarks, expressing gratitude to all stakeholders who participated both in person and virtually. We at HEPU deeply appreciate the support of our partners and stakeholders. Together, we have the power to create a positive change and look forward to seeing you at the 14th International Think Tank.